Good morning, my name is Dr.S.Srinath. I am a consultant neurosurgeon at Renova Hospital, Kompally. Today I am in front of you to talk about the treatment of stroke or cerebrovascular accident. Any stroke is by definition meaning of a sudden onset of weakness or loss of neurological function of part of the body because of the disruption of the blood supply to the specific part of the brain. So cerebral vascular accident can be two types. It can be ischemic or a decreased blood flow leading to problem, or a hemorrhagic aspect where there is a rupture of blood vessels inside the brain leading to externalization or outflow of blood into the brain part and damaging it. So any cerebrovascular accident can be divided into two parts, that is ischemic and hemorrhagic. So but the deficit or the problem or symptom can be the same. The most common symptom which we encounter is hemiplegia or hemiparesis or weakness of one half of the body. This usually occurs due to a loss of the function of the opposite side of the brain, whereas the right side of the brain controls the left half of the body and the left side of the brain controls the right half of the body. Any damage of the area specific to the control of weakness or power in that part of the brain can lead to the development of weakness in the other half of the body. So the commonly we see is hemiplegia or hemiparesis. Hemiplegia is a total loss of power and hemiparesis is a partial loss of power. So any such patient, when we encounter in the emergency, we usually try to manage the patient by evaluating the blood pressure first, because any high blood pressure or low blood pressure can lead to such symptoms. So any high blood pressure will the patient will need to be controlled with immediate injections or medical aspects, and followed by which the radiological evaluation of the brain with a CT scan and MRI should be done. Any such CT scan or MRI will show the presence of a bleed or an ischemia or a loss of blood circulation in that part of the brain, and therefore a diagnosis of a cerebral vascular accident can be made. So upon the diagnosis of a cerebral vascular accident, the most important aspect in the immediate part of the treatment will be an ischemic aspect, because if the patient arrives in the care of the doctor within 3 to 4 hours, there are presently injections which are available which can almost totally reverse the problem of the patient and can make a near total recovery. And this is possible when the middle cerebral artery or a major vessel in the brain is blocked by a clot or a thrombus. There are clot busting injections which are available, which are called tenecteplase or alteplase, which will dissolve the clot immediately and therefore restore the blood supply to that part of the brain and allow near normal recovery. If the presence of a bleed is determined in the CT scan, the amount of volume of the bleed can be determined, and therefore if it is more, the patient can be taken up for emergency surgery and the bleed can be removed and the pressure in the brain can be decreased. If the patient has gone through these immediate aspects of management, the long-term aspect would be the rehabilitation and continuing medical care and management of comorbid conditions such as hypertension, diabetes, thyroid and hyperlipidemia states. So these are the most common things which are found as comorbid conditions in the presence of stroke. The lifestyle conditions which are important are presence of smoking and consumption of alcohol regularly, which also need to be stopped immediately. So any such patient which are encountered are immediately managed with in the ICU, followed by gradually shifting into general ward or room and then discharged with appropriate medication. The regular follow-up with medication and as well as hematological evaluation of the blood parameters and regular monitoring of BP and management of BP and sugar with appropriate drugs is important for long-term recovery as well as prevention of recurrence of the same problem in the future. Any such weakness of one half of the body will require rehabilitation with physical therapy or physiotherapy, and any physiotherapy if required can be continued for a long time and therefore which will lead to a better result. Thank you.